Hello, this is Michael Thompson, Colton Osborne, Charles Russell, and Paul Nelson. Today we'll be talking about ACA, short for the Affordable Care Act, also known as Obamacare. Signed on March 23rd, 2010, some goals of the Affordable Care Act are to have affordable health insurance, improve the quality of insurance, reduce healthcare spending, and regulate the health industry. Before the law, one could be denied coverage or treatment because they have been sick in the past. They could get charged more because they were a woman, be dropped mid-treatment for making a simple mistake on an application, and have little or no way to fight insurance company appeals. As of January 1st, 2013, there are 315,091,138 people in the United States. 16% of them are without health insurance. This equals out to about 44 million people without insurance. Next will be Colton, and he'll be talking about the Affordable Care Act's effect on businesses.
So how does the Affordable Care Act impact businesses? First of all, businesses that have 50 or more full-time employees are required to provide health care for all of them. However, under the Affordable Care Act, part-time employees are counted too. A part-time employee equals half of a full-timer. The Act also states that anyone that works 30 hours or more per week is considered a full-time employee. These changes have created much confusion for some businesses, such as those in the restaurant industry, because these are not standards that they commonly use. The Act has proven to be so troublesome for restaurants that the Restaurant Association has created the Obamacare Primer, which aims to educate businesses whether they fall under the 50 full-time employee threshold or not. An unintended consequence is that businesses are cutting employee hours, and in some cases even firing them. This is being done to save money due to the increased healthcare costs created by the Affordable Care Act. Some specific businesses that have been impacted and that illustrate the negative effects of the Affordable Care Act are IBM, Delta Air, UPS, Papa John's, and SeaWorld. IBM recently announced that they told 110,000 retired employees that they will no longer be eligible for the company's health insurance, and instead will be given subsidies to go and get their own insurance. These individuals are worried that they will not be able to get the same coverage elsewhere. Delta Air announced that they are no longer going to be offering special health care plans for pilots. UPS has said that employee spouses are no longer going to be eligible for the company health care plan. Papa John's announced that they will be responding to the increased cost from ACA by increasing the price of their pizza, which will directly impact the consumer. And finally, SeaWorld announced that it would be lowering the maximum amount of hours per week for part-time employees from 32 to 28 hours per week. 80% of SeaWorld's employees are part-time. We recommend a number of changes to be made. Firstly, in terms of determining the number of full-time workers, policymakers have made the Act too confusing for businesses. In this regard, we recommend that the following amendments be made to the Act. Firstly, don't include part-time workers in the calculation, and raise the number of hours worked per week to 40. This makes it easier for businesses to determine if they need to provide health insurance or not. Secondly, businesses that, without a doubt, have more than 50 employees should find other ways of cutting the increased cost from ACA. Businesses need to become more efficient in this regard because employees are what sparks innovation. Scaling back hours and getting rid of employees completely hinders innovation. Clearly, changes need to be made by both sides. And now Charles will talk about the coverage gap.
A crucial unintended consequence of ACA is what politicians are referring to as a coverage gap. ACA was banking on all of the United States expanding Medicaid, but 26 states sued the federal government, claiming that ACA relied on an unconstitutional expansion of federal power. The U.S. Supreme Court upheld the law, but gave states the option of not expanding Medicaid. The federal government offered to pay the full cost of the expansion for 3 years, and then the states would have to pay 10% of the annual expansion costs. The Congressional Budget Office estimates the current expansion will cost the federal government nearly $800 billion over the next 10 years. The 26 states still declined the offer. People within the gap earn too little for health law subsidies for private insurance and earn too much to be eligible for benefits under state programs. The failure to expand Medicaid coverage by some states not only adds fewer insured patients, it also eliminates the payments hospitals had long received to cover the cost of uninsured people they treat for free. For now, nearly 5 million people ages 18 to 64 get no financial help to buy coverage because of the gap. According to estimates, many of those people are clustered in the South, living in states where income limits for Medicaid coverage have historically been among the lowest in the United States. The Affordable Care Act, as well as the GAP, are transforming more than health insurance. The Act is transforming the way doctors and nurses actually care for their patients. The primary change is in the form of bundled payments from the Medicare program for some procedures, and no financial incentives for medical errors or other mishaps related to the poor patient care. A cardiologist at an Ohio State hospital says it boils down to everybody in the healthcare system gets rewarded for doing more rather than doing the right thing. As a result, everything is more expensive. A key question for healthcare reformers trying to rein in costs is how to create a less expensive system that still provides good care. A survey of 922 U.S. hospital board chairs revealed that only 31% of the group regarded patient safety or effectiveness of the clinic as a top priority. Quality of care has not always been first and foremost in the minds of U.S. hospital leaders, and the ACA has dug it up, making it blatantly clear to the public. In order to fix the gap problems, we recommend the 26 states need to expand Medicaid with the help of the federal government because it's their own people who will suffer. Offer more aid to the states that absolutely need it and decrease the amount of aid for the states that are better off. To fix the quality of the clinics in the United States, we recommend reevaluating the leading health professionals by compensating those who do great work and not just get through as many patients trying to make the most amount of money. The compensation should be clear-cut and motivate medical-involved individuals to give care to the best of their ability without people receiving better quality care than others for the same amount of money. Up next we have Paul, and he will be discussing ACA's effect on the younger generation.
Here are some more unintended consequences that are going to affect the younger generation. Younger people will not worry about having medical insurance until they are 26. This is because the ACA covers them on their parents' plan until they are 26. Some negative aspects of this is the safeguarding feeling younger people will have. The feeling of security is bad because after they turn 26, then the inevitable of new responsibility and stress will overwhelm them. ACA will also be different for different states. If they implement it, they're closing and opening the gap. This will hurt 26-year-olds because there is a severe inconsistency in each state. As each person turns 26, they will not be used to the 6 months. This is because their parents once covered them. This is just another huge responsibility for younger people to take on. Other things are stressing younger generations at this age. Many of them are worrying about student loans, home mortgages, and car loans. The ACA implement them to take on their own health insurance is another huge responsibility. On a more positive note, a good consequence is the expansion of life expectancy. Medical coverage allows people to get better when they get hurt or fall ill. This will increase the population by taking out a large percent of deaths that occur with people who once did not have medical insurance. This could also increase the possibility of more jobs in the health industry. If there are more people getting sick or getting hurt. So there is thus a greater need for people to take care of these people. Another beneficial point from the ACA is the increase of risk in the job market. People won't be focused on getting a job that has better health benefits. They will generally have health insurance and prefer go looking for a job they like instead. With this increase of risk, there will be an influx of creativity. Creativity is good because there will be an innovation in new industries. You take away a limit on the population, they go out and make something new. As discussed before, the younger generation will fall into the gap. Final recommendations. After looking at the negative and positive unintended consequences of the ACA's impact on the younger generation, we as a group have some suggestions on how to fix these. We suggest moving the age from 26 to 30. This will give the younger generation 4 more years to mature and take care of their other responsibilities. We should also educate people more on the medical coverage. When you do not know something, it is easier to make mistakes and have a fear of these mistakes. With informing people, they can understand how ACA works and therefore have a better relationship with it. This will create more consequences that are positive for everyone. And here are our references.